Hello, everyone. And if you are joining me on this live session, welcome. This is my very first podcast that I have ever performed. So if there's any glitches or anything, please forgive me. If you are showing up live, please put in the chats a thumbs up. And if I say anything on here that resonates with you, please put resonate in the chat. All right. So let's talk about the reason why I am creating this podcast. First and foremost, I've kept my mouth shut for years, swallowed every shift, every insult, every trauma, because that's what we do, right? We show up, we shut up, and we survive. But silence, this shit is killing me. This podcast, this moment, is for every nurse, nursing student, and medical professional out there who needs a safe space to speak the raw, hard truth. We need to be able to name the burnout, the bullying, and the breakdowns. This is where we talk about the real shit. Welcome to episode 1, From Silence to Shift Nurse Talk After Dark. So, again, Shift Nurse Talk After Dark exists to tell the raw, unfiltered truth of trauma, nursing, and transformation so that every student, every broken soul, every quiet fighter out there knows you are not alone. And if I can survive this, if I can rise, you can rise too. We're all in the same boat. Shift Nurse Talk After Dark exists to tell the story of the unspoken so that every student, every broken soul, every quiet fighter out there knows that we are all here together and we're going to support each other. Now, before we begin, I want to be very, very clear. This podcast is not going to be for everyone. If you're looking for a sugar-coated version of what it takes to be a nurse, this isn't it. If you're uncomfortable hearing the raw, unfiltered truth, this podcast is not for you. But if you're a nursing student who's barely hanging on, if you're a nurse carrying the weight of untold stories and trauma, or if you're just starting to wonder whether you truly are cut out for this type of work, then you're in the right place. And I am here for you. So let's start with the foundations. When it comes to nursing school, and right now I'm going to be talking to people who's going to be entering the nursing profession, entering nursing school, or already in nursing school. There are two things you can't be taught in nursing school. You're not going to be taught this by your professors. You're not going to be taught this by your mentors, not by your textbooks, and not even by experience. You have to have these two traits, or you should not be in nursing, thinking about enrolling in nursing. The first is empathy, not sympathy. Sympathy says, I feel bad for you. Empathy, on the other hand, says, I see you, I feel you, and I'll stand in the fire beside you. If you can't feel what your patient might be feeling, if you can't hold space with them in their darkest hour, there is no amount of clinical knowledge that will make you a nurse. At least a nurse that your patients can trust, other nurses can trust, and definitely not a provider. Now, what's the second principle? The second principle is what I like to call as the coma test. It's simple. Would I trust you to take care of me if I were in a coma? Think about that for just a second. I'm unconscious. I can't speak. I don't even know if you're even in the room. Would I, or for your instructors, because your instructors are going to be thinking this too, so let's put them in there. Would your instructor or I trust you to do the right thing, the safe thing, and the human thing when no one is watching? If you answer no to either one of these questions, then if you're planning on being a nursing student, don't start. If you're a current nursing student, please pack your bags and leave the program now. So, when it comes to the nursing program, the struggles are real. Let's face it, nursing school is nothing but pure hell. Now, I've been a director of nursing programs. I've been a clinical instructor. I've been a didactic instructor. I've been a nursing student. I've been a nursing student for 15 years. And this is something I used to tell all of my students, regardless of what position I was in, whenever I was teaching and instructing, which I still teach and instruct. And that is, if your family and friends aren't calling to check on you to see if you're still alive, you're not anywhere near being committed enough to your studies to make it as a nurse. So let's look at the real breakdown. And this obviously is going to depend on the state you're in, the program requirements of your school. But let's just do an overall generalization on this. If you apply for an LPN program, that will be 1 full year of intense study. For an associate's degree in nursing, you're looking at a 2-year commitment that will test everything you got. And if you're applying for a BSN program, you're looking at 4 years of pure dedication. Now, when I say this, these aren't just numbers on a calendar. When I say a full year or 2 years, I mean full immersion, 100% focus and dedication. And what does that look like? Your textbooks, more today's day and age, your electronic devices will become your pillow. You flashcards, these are your new best friends. In your clinical rotations, oh, those are going to be your second home. So I've had students ask me about motivation. How do you stay motivated through nursing school? Well, the word motivation, that's a warm, fuzzy feeling that got you to sign up to the program. If it got you to if this was able to get you through the entrance exam and pass and go through the process, that's good. But here's the truth. That motivation you have, it's going to vanish. And when it does, you better have something stronger to fall back on. And that, my friends, is what we call discipline. When you sign up for nursing school, make no bones about it, you are signing up for war. And this war is not against others at all, but this war is against yourself. Nursing school will most likely be the top 5 most challenging things you will ever do in life. And it may be the very first top challenge that you have ever done in your life. Every single day, you're fighting battles. The battles against your pillow when you need to drag yourself up for clinicals at 5 a.m. My case, 3 a.m. The battle against self doubt, especially when you fail an exam that you have studied weeks for. The battle against frustration when dealing with combative patients, who, by the way, will spit at you, try to hit you, bite you, pull your hair, punch you, kick you, all the above. And if all this isn't enough, when you have a battle against the voice in your head asking, am I strong enough? Can I really do this? Should I even be a nurse? Now, there's also a thing called the hidden curriculum when it comes to nursing school. Oh, listen up to this. I am divulging some secrets when it comes to the nursing program and curriculum. Because this is definitely something they don't teach you about in orientation. The hidden curriculum of nursing school is where math becomes your new language. Being able to perform quick, accurate math medication calculations at 3 o'clock in the morning when a patient is coding, you better be sharp. Also, your social life when you're in the nursing program is going to disappear. And you know what? That's okay. You know why? Because this is temporary, but it's also absolutely necessary. And when you make your first mistake, that will haunt you for the rest of your life. But here's the thing, as long as you learn from your mistake, it will also make you a better nurse. Now, let's talk about financial. This journey isn't just emotionally expensive, it is financially draining to plan to pay for your textbooks, which may be more than the cost of your rent that month. Then you have your clinical uniforms and all of your equipment. And when you're in nursing school, guess what? That means less time for work, which means tighter budgets and the physical demands are high. Your body takes a beating in this profession. Now, before I continue, if there is anyone on here during the live stream, please put in some comments in the chat if there's anything you would like to discuss. I am more than willing to stop talking about what I have here and talk about what you want to talk about. Again, I am creating this podcast not just for me, but for all of you. And again, please put the word resonate somewhere in the chat or in the comments section. So again, I know that you're liking the content that I am providing you. Now back to your body takes a beating. You're gonna have to have good, proper body mechanics. Otherwise, you're gonna destroy your back. Trust me on that. You're also going to need to have comfortable shoes. Your feet and ankles will thank you later. And you're also going to have to build stamina because you know what? 12-hour shifts are not a joke. Let's talk about the truth about working 12-hour shifts. They're not 12-hour shifts. They're going to turn into 14 to 15-hour shifts. Why? Because you're going to have to document on all the notes that you have and do your charting. And it never fails towards the end of the shift when you get ready to go home. Guess what's going to happen? That's when there's going to be a new admission coming up. There's going to be a patient that's going to code. And again, your 12-hour shift will turn into now possibly 14 to 16 hours. So if you're still here listening, thank you. Thank you to all my nurse warriors out there. And yes, that's what you are. Whether you're just starting this battle or you're deeply in the trenches, you're not just students or nurses. You are warriors. You fight for knowledge. You fight for your patients. And sometimes you're even fighting for your own survival. In this profession, I have came up with what I like to call the Nurse Warriors Code. As nurse warriors, we believe in a different code. We don't just study, we train for battle. We don't just take tests, we conquer challenges. We don't just care for patients, we fight for their lives, literally. And you know what? Every warrior needs to have gear. So, what's your equipment? It's your stethoscope. Your stethoscope is going to be your first weapon of choice. Your scrubs, they're going to become your armor. Armor against blood flying onto your body, secretions, urine, fecal matter. Your knowledge, this is going to become your shield and your compassion. This is your strength to continue the battle, the strength to continue doing compressions, the strength to stand up and fight for your patient who needs you as an advocate. And hovering over all of this, you're also going to have to prepare to take your NCLEX, the good old next gen. Guess what? It's the final boss. But here's the truth. If you survive nursing school when you're already, then you're ready. If you survive nursing school, then you're already stronger than you ever know. And you know what? The NCLEX, it's just a test, piece of paper at that point. You're preparing for something so much bigger than the NCLEX. You're preparing to save lives. And to my fellow nurse warriors, when your body aches, when your mind is exhausted, when you are questioning everything, please, please remember this. Warriors aren't born, they're made. And you're being made into something extraordinary right now. Nurse warriors, I ask you this. Are you ready for battle. If you're thinking about becoming a nurse or wondering if you got what it takes, start by asking yourself two questions. Can you truly feel what others feel? And could your instructor trust you with their lives? If not, then you got a lot of work to do. And that work is putting the program, and that work is putting more intention into the program, making yourself better, or just completely leaving the profession. Thank you for joining me on my very first podcast. I'm so happy that you've been here and been listening. Shift Nurse Talk will be back soon. Until the next time, stay real, stay strong, and stay seen. And above all, thank you, everyone, for wanting to become a nurse or already a nurse. Thank you for what you are doing. You are truly making an impact on people's lives, and you're making impacts on families' lives, and you may not even be aware. I'll give you an example. I was working in the unit, and patient's family member um, was kind of sitting there, and I told the patient's family member, you know what? You need to go home. You need to go home. You need to take a shower. You need to rest. We got this. We got your loved one. I'll make sure that nothing will happen. You know what I found out? Probably 6 months later? That simple comment that I had said, that person felt seen. They felt heard. They were actually planning on going home and killing themselves. And that simple gesture of saying, we got this, take care of yourself, was enough for that person to not fully lose it and commit suicide. I never would have known had another family member who saw me in a store come up and told me the conversation. And this family member, by the way, told me that they were a nurse and they went through the nursing program and they signed up for the program because of the kindness that they saw that I gave their loved one. To me, I'm just doing my job. I'm taking care of people, and I'm just talking to people and letting them know, you know what? There's a lot of stuff going on right now. And that's one of the hardest lessons I ever learned as a nurse. You have to be able to take care of yourself before you can care for others. And as nurses, that's a tough pill to swallow because we're so used to running up and down the halls, not eating, or stuffing our face with whatever food. Heck, there's been times where I held my urine in for, I kid you not, probably a good 6 hours. But you have to be able to take care of yourself. Otherwise, you cannot care for others. All right. This is where I'm going to end this episode. Please, if you're hearing this and it's not live, or you are hearing this and this is live, please leave me a comment. please put in comments, Nurse Warrior, resonate, something, so that I know that what I'm saying here is helpful and striking a nerve for you. All right, everyone. Till the next episode, keep strong.